Some of the trends we've been seeing over the last 18 to 24 months, and this is related specifically to the healthcare space, is we're seeing more and more the hospitals moving the production data centers out of the hospital. Why? The existing data center can't support the new infrastructures of the systems coming in. Hospitals need the space for more valuable, for billable services. There's no expansion space. There's no cooling or power available. And the one we're hearing more and more now is no capital for the expansion. They can't come up with the $5 to $20 million to renovate a data center. We see a lot more second sight with real-time replication. The cost of disk space has come down tremendously. The cost of the replication software has come down. More importantly, as the network costs have come down. And as you move more and more to electronic wireless handhelds, prescription writing, medical records, you can't afford downtime. So there's no tolerance for downtime. And you can reduce other non-apparent costs by going to second site. We've got a lot of companies moving their tape libraries to us and then doing the backups from a remote location so they don't have to do off-site tape storage every day off the hospital. And also the data is then local to the recovery site. As I said, hospitals are deploying a lot of high-speed fiber. They're outsourcing the backup. It's a job that's typically being run at night, and all you need is tape shufflers. We see a lot of deploying now of tiered storage. And when I say tiered storage, I'm talking about storage where you're accessing the data every day on your very fast disk, and then you're moving it to slower disk or slower disk that's been deduplicated the data out there to conserve space and help reduce the cost of storage. Virtualization is now finally taking off. 4.5 years ago, we started a skunkworks project in regard to virtualization, and none of the healthcare software providers were supporting virtualization. They saw it as cannibalizing their hardware sales and reducing their hardware sales. Today, more and more of the software providers in the healthcare space are now adopting or endorsing virtualization, and that's only going to accelerate. We see outsourcing of your typical email, virus, spam, and layering compliancy solutions. A lot of that is because it's mundane tasks that are repeatable, they can be outsourced, and compliancy is everyone's struggling to keep up on compliancy. Why build applications from scratch? And then there's outsourcing happening in the monitoring and application area. A little overview, I normally don't like to make this salesy, but I couldn't go through some of this without talking about what we're doing because that's our trends. But we are a hosting and disaster recovery provider based out of the Lehigh Valley with 3 facilities in eastern Pennsylvania. We do healthcare, financial services, and SAP are our 3 vertical markets. We've been here in Pennsylvania about 10 years, and as Kelly said, we've been growing rapidly. This gives you a little idea of our sites, pictures of our sites around Pennsylvania. What I wanted to talk about a minute here is our newest site that we just are bringing online here. It's located about 10 minutes west of Allentown, Pennsylvania. It's in Breiningsville, PA. It was the former AT&T world headquarters of the fiber electronics business. And we've leased 228,000 square feet, and we've got a contract to buy the part of the facility, actually. This will be our newest data center. It'll support over 400 watts per square foot. We have the ability to put 100 megawatts of power to the campus. And what's nice about the building we're in is it's a completely isolated building from the rest of the campus, so we can manage security, we can manage high availability and full control. So it's a very impressive site for us. We invite anyone that'd like to come up to take a look at it, and I'll be around later for questions.